So I am going to come in at the very beginning. Before I come in the room, I would have checked my doctor's orders. I would have checked my policy and procedures. I would have gathered up all of my supplies. I would have checked all my supplies to make sure that they are within expiration date and they're sealed and intact. I'm going to come into the room. Hi, I'm Amanda. I'm going to be the nurse taking care of you today. I'm going to grab my hand sanitizer. Your hand sanitizer is on the wall. And picture this setup. Your hand sanitizer will be right here on the wall, so you can just reach over for that initial hand sanitizer once you set everything down. Mine's a little farther away, so I went ahead and grabbed it. I'm going to come in. Hi, my name's Amanda. I'm going to be the nurse taking care of you today. Can you give me your name and date of birth? Anna Taylor, grade 4/24/1991. Are you allergic to any medications? No. Are you allergic to any cleaning supplies? Any shellfish, iodine, tape, any type of adhesive, anything like that that you're aware of? No? Great. So what we're going to be doing today is we're going to be doing, I'm going to be setting up a sterile field for your physician. And this is a sterile field, so I ask if you need to cough or sneeze, if you would just turn your head over here to the left towards the wall as to not sneeze or cough on the field, I would appreciate it. That way it'll maintain the sterility, which will be best for you. Do you have any questions before we get started? Wonderful. All right, so what I'm going to do, over here, we're recording this here at Sim, so y'all can all see all the angles, but over in Leveland, you will have a piece of blue tape that'll be sitting right here. Please make sure that this front table is behind the blue tape. That way we can see everything, because if we cannot see it, then we cannot grade it and you will not get credit for it. So please make sure when you do a setup. So I have all of my supplies. The first thing I'm going to do is I'm going to take my red bag. You can actually have this pre-set up. I'm going to take this and put this over the front of the trash can, because if I need to pour out any liquids, I want to pour it in the back, because all of your supplies that you're going to throw away will go in there, and I just want to make sure you keep them as dry as possible as you're going to continue to reuse your supplies. So since I touched my trash can, I'm going to go ahead and I'm going to wash my hands again. Again, we want you to use the solution that's on the hand sanitizer on the wall, but mine's so far away. All right, so I have inspected all of my supplies. I have made sure that everything is within expiration date. Everything is good and intact. So the first thing I'm going to do is take my sterile field. I'm going to open up a weigh. Once I start opening this up, once it's set, it's set. I am going to open it. I can grab the edge as to not cross my 1-inch border, okay? Next, I'm going to open up this towel. So what has to be sterile is the 1-inch border, so I'm going to go in through the sides. And the inside of this towel is what's important. So then I'm going to take it and I'm going to open it up, away. I'm going to come around to this side, keeping my eye on my sterile field at all times. I come around because it's easier and there's a less likely chance that you're going to cross the towel. So I'm going to open it up. Once it's open, it's set. Do not move it. I've now established a 1-inch border all the way around, and I know where that is. The next thing I'm going to do is I'm going to grab my bowl. I go ahead and make a mitt up underneath. I step back so as to not cross it, give myself plenty of room, and I'm going to make a bowl or a mitt as I'm unwrapping this bowl, okay? I like to get all of my packaging away so I don't run the risk of contamination. So I'm going to go in and I'm going to set my bowl right here. I'll come straight out and I'm going to dispose of this into the trash can. Next, I'm going to open up my 4x4s. Again, I have my eyes on my sterile field at all times. I've looked at my 4x4s. They are within expiration and they're good. There's a little tab you can start to pull. pull away from you as to not cross. Okay, and then I'm going to come up, again, I know where my 1-inch border is, so I'm just going to barely come within that and pop it in there. There you go. And then I can get rid of that. If for some reason your 4x4, your bottom 4x4 is within that 1-inch border, do not panic, because what has to be sterile is on top. Is that top 4x4, and it's not within the 1-inch border. It would not be touching, so you would be good. The next thing that I want to do is I want to get my solution, whatever the doctor ordered. You have normal saline. I have looked at it. So a couple of things about your bottle of fluid is the first time that you open it, you do not have to lip it. However, once the solution has been opened, sometimes they'll use it multiple times. It should have a date, time, and initial on it from the previous person. If it does not, then you need to dispose of that. You cannot use it. It also, if it does have a date, time, and initial, it has to be used within 24 hours. And then you're going to want to lip it once it's been opened. So I go ahead, I've looked at my solution. It is what the doctor's ordered. Everything's intact. It's within expiration. I'm going to palm my label. The reason why I palm my label is because when I pour this fluid, I do not want fluid running down onto my label and then I can't read what it is. So I'm going to open up my cap here. Now I have 3 sterile fields, my cap, my bottle, and that. So I'm going to keep my eyes on there at all times. I'm going to step over. I never want to turn my back onto my field. I'm going to go ahead and lip it. Even though this is new, we still want y'all to lip it to get in the practice of that. This actually will wipe off any germs, especially once it's opened, that may be on there to protect your patient. Then I'm going to go in to my bowl, and I'm going to go to from the shortest distance. So for me, it's this side, this left side. So I'm going to come in. I'm going to barely come over, and I'm going to pour it. I'm going to stop. I'm going to come out and around. I still have my eyes. I could see my cap the entire time. I'm going to go ahead and put my lid on it. I'm going to put a piece of tape, and I'm going to date, time, and initial when it was opened, and I'm going to set it aside. Now I'm ready to put on my gloves just in case. I'm just going to make sure. For me, I'm going to do just a little bit of a medical hand wash. So I have my gloves, and you're just going to open up your gloves. What has to be sterile is the inside of the package, so I can touch all the way on the outside. Again, I'm not turning my back on my field. I can see it at all times. When you open up sterile gloves, sometimes they want to fold back on you, and if they do, they're contaminated. So from the very beginning, I kind of fold them. I do not cross over because I can see the gap and I can see my sterile gloves, so I don't want to cross over. I'm going to come up to this edging, and I'm going to run my hand. I run my hand all the way up to kind of break it open a little bit, loosen it up a little bit. Then I'm going to open it. If at this point something happens and the package falls back over the top, you have to start your sterile gloving over again. You have to get a new package. But in this case, it has not. Take your time doing this and get them set, okay? So because I don't want to reach across any way and cross over any gloves, I go ahead and step off to the left because I'm going to put my right one on first. I take my fingers and I just pinch the edge of the cuff. I come straight up and come straight back. I'm going to go ahead. Take your time doing this. I'm going to pull them on. Once they're on, I'm done. I'm going to come back over, and now sterile to sterile, I can touch anything on this glove that I want to. If I need to, if it starts to stick, do not panic. Just take your finger. You can hold the 1-inch border here. You can put your finger on the package. Just do not get close to this glove. And you can go ahead and pick this up. Do not scrape the fingers across the package, as you can potentially contaminate it. So you just should come straight up. And go ahead and get your glove. Get it the way that you want it. When you begin to commit your non-sterile hand to the glove, you need to hijack your thumb. It just should be reaction. Commit, hijack your thumb so you do not contaminate. Go ahead and put your glove on and stop. At this point, you can inspect your gloves. You can see, make sure that they're good. You do not want to drop your hands below your waist, as if you drop your hands below your waist, I want you to try this yourself, is you'll notice that you lose sight of your gloves right here, and that's right here at your waistline. Nor do you want to raise your hands above your head, go out this way, hold your hands to your uniform as you've contaminated. So what I encourage students to do is put their elbows to their sides, kind of like a T-Rex, and keep your hands right here, and that way you can see everything at all times. So the next thing I need to do is I just need to grab my 4x4 and transfer it to my bowl. So I'm just going to reach in. I'm going to grab, and if you grab a couple, it's okay. I'm going to grab a 4x4 and I'm going to drop it into my sterile bowl. At this point, my sterile procedure is complete, and so I'm going to go ahead and clean up the mess. I'm going to use my sterile gloves because they do not have a lot of any type of contaminants on them. If they did, you could take off your gloves, glove to glove, skin to skin, do a medical hand wash, put on non-sterile gloves to clean everything up. But because mine don't, I am going to clean it up this way. Now, I'm not going to go in from the bottom and touch the table and all of that. I'm going to keep my cleanup all within the inside, and I'll show you. So I'm going to take this. If you have a lot of water in your bowl, and you can take that and you can pour it back into the main trash can, do not put it into your red bio bag, as everything will then get wet. So I'm going to just take this, I'm going to clean up from the inside. I'm going to tuck it all in, again staying to the inside, not touching my table to get contaminants if I do have them on there that I cannot, anything I can't see. I'm going to put this in my red bio bag. I'm done. I'm going to do glove to glove, skin to skin, do a medical hand wash. And I do want to encourage you, get in the habit of saying that. Glove to glove, skin to skin, do a medical hand wash. That way you do not forget it. I'm going to go ahead and take my packaging. Because we reuse so much here, I'm just going to take this and just set it right there. That's the end of my procedure. I'll gather up any supplies that I need to. These will all stay in my patient's room there for the next time. Okay, Anna, I am done with your procedure. Do you have any questions for me? You did very well, and I appreciate your patience. No? Okay, excellent. I'm going to do my first safety check. I'm going to make sure my bed is in the lowest position. My side rails are up ×2. My bed is locked, and the call light is in place. Anna, your call light is right here. Call me if you need anything, and I'm going to be back in 30 minutes. As I get ready to go, I am going to again do my second safety check. Make sure that my bed is in the lowest position. My side rails are up ×2. The call light is in place, and my bed is locked. The last thing that I want to do whenever I go out, first I want to assess to make sure that I did not have any breaks in sterility, which I did not. Any expected or unexpected outcomes that occurred, I want to make sure that I report those to the physician if I need to. And then I want to notify the physician of anything that was not expected, or if I just need to tell him what's going on, and then I want to document. That'll be the last thing I do, and I'll do that either in the room or the nurse's station, wherever your facility has you document. Okay, any questions? Wonderful. Again, I have laid eyes on my patient. Everything is good. Last thing I'm going to do before I walk out is I'm going to do a medical hand wash. Thank you. I'll come back and check with you in 30 minutes.